You just had a tooth extraction. Here are some post-operative instructions to follow. You're going to come out biting on some gauze. Stay biting on the gauze for about an hour after surgery. You're going to have blood in your saliva. The gauze is to help absorb that. If it continues to bleed, replace the gauze, lightly dampening it first with warm water. Keep pressure for another hour. If it continues to bleed, again past another hour, go ahead and dampen a tea bag with warm water, doesn't matter what flavor of tea bag, and bite down for exactly 10 minutes. It always helps to set a timer just to make sure. Over the next 24 hours, no drinking through a straw, no carbonated beverages, no alcoholic beverages with the pain medication, no driving or going to work on the pain medication. No heavy spitting into the sink until tomorrow. You also may start to experience some swelling directly after surgery. This is completely normal and will go away in a few days. If it starts to get worse after it gets better, give our office a call. Over the next week, you may experience some swelling and associated jaw pain. This is completely normal and will go away on its own. We recommend eating softer foods, stuff you really don't have to chew, the next 3 to 4 days following surgery. This includes soup, smoothies, ice cream, mashed potatoes, yogurts, that kind of consistency. Increase your diet as you start to feel comfortable and your jaw starts to feel better. Make sure to drink lots of water and stay hydrated over the next few days as well. Also, you were given a local anesthetic during your surgery today. It may take a few hours after surgery for that feeling to come back in your jaw. Also, after being sedated, you may experience some side effects on your way home. You may experience some short-term memory loss and a little bit of shakiness. This is completely normal. You will probably go home, go to sleep, wake up, and not even remember the car ride home. Take it easy the next few days following surgery. Avoid heavy exercising over the next 3 to 5 days, and then increase your intensity after that. It is important to stay away from little seeds, nuts, chips, and popcorn kernels. These are the things that like to get stuck in your socket. This can create irritation, which can lead to infection, and we don't want that to happen. The bones surrounding the extraction site will be vulnerable over the next few weeks following surgery. Avoid crunching down on anything hard in that site over the next few days. Doing so may damage the bone before it's had a chance to heal. If you were given an irrigation syringe, start that 5 to 7 days following your surgery. You're going to place the tip down inside the extraction site and flush out the socket. You're going to use the mouth rinse we prescribed you, or salt water, or just regular water if that's all you have. It may take a little over a month for that site to fully close, so make sure you use the syringe. If you stop using the syringe before the site has healed, you may get food impaction and that may cause an infection. When you get home, make sure to not lie completely flat when you go home to go to sleep. Make sure to lay in a lazy boy position or just keep your head propped up above your heart. This will help stop the bleeding. If sutures were placed, most likely they will resorb on their own. You don't have to come back to get them taken out unless directed otherwise by your doctor. If a membrane was placed over the extraction site, it is also most likely resorbable and will come out on its own, usually in the next 2 to 3 weeks. It may become discolored from the food you're eating and from bleeding from the site. This is completely normal. If the membrane comes out in the next few days following surgery, this is also completely normal and you don't have to come back to get it put back in, unless directed by your doctor. Your doctor will let you know if a non-resorbable membrane was placed and will schedule you an appointment to check the membrane routinely or have it removed at a later date. If bone grafting was placed at the site, you may just experience little particles working their way out of the tissue. This is completely normal. You most likely will not even notice it, but it will create a sand-like texture in your mouth. This is completely normal, and it does not mean the bone graft is failing. We hope you find these post-operative instructions helpful. If you have any questions or concerns following surgery, please give our office a call. We are always happy to answer any questions you may have.